We're back now at 7:42 with a health alert for men who take the drug Propecia to fight hair loss. Researchers at George Washington University's School of Medicine and Health Sciences say it could lead to long-term sexual side effects. NBC's chief medical editor, Dr. Nancy Snyderman, is here with more on that. Nancy, good morning.
Good morning, Matt. These are not new side effects, but they've been considered temporary for a long time. But because people have consumed, they've gone away. They haven't been so worried. But this new study raises the question, could the sexual dysfunction be permanent?
Propecia, helping make hair loss history.
Some men who've experienced male pattern baldness, a hair loss on the top of the head, which accounts for more than 95% of hair loss in men, have chosen to treat the condition with a prescription medication known as Propecia. Propecia's website posts the following warning. In clinical studies, a small number of men experienced certain sexual side effects, and that each of these side effects occurred in less than 2% of men and went away in men who stopped taking Propecia. But this study, published in the Journal of Sexual Medicine today, says not so fast.
I surveyed a bunch of young, healthy men who had no medical problems, no psychiatric problems, no use of any prescription medicines, who took the medicine Propecia, or finasteride is the generic term for it, and while taking the medicine they developed sexual side effects such as low libido, erectile dysfunction, problems with arousal, and difficulty in orgasm.
Out of 54 former Propecia users with persistent sexual side effects lasting for more than 3 months, 96% continue to suffer those side effects despite stopping its use.
This is very frustrating for these men because they go from one doctor to another. We're just in the infancy of trying to understand what's going on.
The irony here is that many men are taking this medication so that they can be more sexually attracted to people that they want to attract.
Merck, the manufacturer of Propecia, says their product has demonstrated safety and efficacy, that labeling appropriately describes benefits and risks, and that a causal relationship between the use of Propecia and continued sexual dysfunction after discontinuation has not been established. They've also updated prescribing information to indicate that there have been reports of dysfunction that continued after treatment ended.
The most important thing to know if you are struggling with your sexual function is that there is help available, that there are doctors that are ready to listen to your problems and to treat you. You just have to ask for help.
Nancy, we've clearly got the attention of some guys taking this medication right now. What jumps out at me is only 54 men were studied in this survey. That's a small group.
Yeah, like this is a very small group. This is a drug that was initially put on the market to treat benign prostate problems. And guess what? Men grew hair. So suddenly there was another reason for using it. So millions of prescriptions have been written for this long over around the world. But these guys took 54 men who, before they took it, had no sexual dysfunction at all. And although it's small, they believe that this is just the beginning.
Aren't some women prescribed Propecia as well? And does this have the same effect there?
They should not be prescribed. This is a man-only prescription. In fact, if women come in contact with it, it can be dangerous.
What would the alternatives be for men, then, who are suffering hair loss now that they hear this information?
Would you really want me to tell you? I think you're better off.
No, let's go to commercial. No, thank you, Nancy. No, of course I do.
Look, I mean, for medications, the reality is most of these medications have some hormonal change in them, and that's why we're seeing, these unwanted side effects. I think this is a time for men to remember, anytime you put something in your mouth, it's a pill, you're going to have a side effect, and perhaps baldness is not such a big turnoff to women.
You think men put too much stake on how much hair they have in terms of being attractive to women? Women care less about hair than perhaps...